have to say I think it's really quite exciting actually. The developments we have here in Pinderfields has been sort of part of the Future Hospital Commission and being one of the 4 pilot sites. We saw this as a huge opportunity for us to try and develop older people services, and at the end of the day to try and improve the level of care we offer to our older patients. So the whole service sort of has started out really as being sort of modelled on the current sort of frailty service that we actually have in the hospital, which is looking at frail older patients who we think might be able to get out of hospital fairly quickly. And we have a very comprehensive team of between physios, occupational therapists, social workers, dedicated and consultants, and nursing staff dedicated to these patients. And hopefully they can turn them around pretty quickly, sort of within 48 hours. We saw the extension of that model being a beneficial thing, but also quite importantly to us as a whole team, we saw other patients who, for example, weren't perceived as being fit enough to get out within 48 hours, that those patients deserve to be seen much, much earlier in the time course of their hospital admission by an elderly care physician. So we would see it as being exciting because 1, we can improve the quality of care of those patients. 2, we can hopefully shorten the length of stay in hospital because we have access to these different services. And 3, we thought we'd like sort of reduce things like readmission rates and mortality rates.
Here at Mid Yorkshire, we're extremely passionate about the care of our older people. We started this project off back last year when we did an audit looking at exactly how many older people come in to the hospital, but in particular, how many have markers of frailty. We found that 79.9% of those over the age of 75 have at least one frailty marker. Due to the current size of the service that we're able to offer, we've decided to cut off in order to be able to see the majority of those with high frailty markers of 80 years of age. But we're also incorporating those over the age of 65 from residential and nursing homes. This is because the whole project nicely links in with all our community work that we're doing, both care closer to home, but also the care home liaison work that is being done as part of Network 6 and the Prime Minister's Challenge Fund.
The Meeting the Challenge programme proposed new models of care for the population of Mid Yorkshire, both inside and outside of the hospital. The new models of care will allow us to centralise our acute patients at the Pinderfields Hospital in the centre of the patch, and also allow us to move our elective patients, or the majority of our elective patients, out to Pontefract and Dewsbury hospitals. We believe that that will provide a better patient experience and a better flow through our hospitals.
The Older Persons Assessment Service has been an evolutionary process over a number of years. Pinderfields and Mid Yorkshire Hospital has 2 acute sites, one at Wakefield and one on the Dewsbury site. With the future development of Mid Yorkshire Hospitals having one acute site based on Pinderfields Hospital, we've been looking at changing the way we deliver elderly care services to meet the needs for our local population. We believe that it's got lots of advantages that the elderly care teams work very closely with physiotherapists, occupational therapists, social workers, and are very used to doing multidisciplinary team assessments on our patients. And the team working, we think, for older frail patients is crucial in identifying their needs and where their care can be best met.
I think from a nursing perspective, obviously a lot of these patients come in with cognitive problems and memory issues, so then we move them around the hospital, they get more and more confused and agitated, more likely to fall, more likely to harm to come to them. So from a nursing perspective, having an area in AAU where older patients will go there, I think the care will be improved, the continuity, there'll be less handoffs of communication throughout the hospital, and we can focus our training and development on staff within AAU around older people.
One of the outputs of the project is that we will reduce length of stay overall for older people, and we're making an assumption because people are seen quicker on the AAU and then discharged home that will have an impact on the total length of stay for the older people's population in the hospital.
So like the ultimate desire for this exciting project for us is that we develop a service based on the needs of our patients, so the patient is the centre and our service moves to the patient rather than the other way around. And we think we can be successful and we can actually improve the quality of care of all of our older patients in the Mid Yorkshire Trust.